So it's estimated that in a couple of years, we will make up 25% of the world's population, but will bear more than 60% of the coronary artery disease burden. Coronary disease is also not a disease of the elderly, particularly in South Asians. So if you can believe it, a quarter of heart attacks in South Asians happen below the age of 40, and more than half happen below the age of 50. So that's why SATHI exists. This Stanford South Asian Translational Heart Initiative was developed about 5 years ago under the leadership of Dr. Raj Dash. We provide personalized, comprehensive cardiovascular risk assessment, and then we really work on aggressive risk factor management through both lifestyle modification and medical therapy, and we use a multidisciplinary team approach to do this. So our traditional SATHI program, the main take home from this slide is to show you that it was very time-consuming, labor-intensive on the part of the patient. So it required 9 in-person visits to Stanford within about a 6-month time frame. And as you can imagine, with the type of population we serve here in the Bay Area, busy young professionals, that was asking a lot of their time. So we were finding that it was a barrier for access to healthcare and healthcare delivery, and really was affecting our patient engagement as well. So that was the impetus for launching CardioClick. CardioClick is a video visit platform that we use to deliver these patients' healthcare. So they establish care with us, and then all they need is their smartphone and the My Health app through Stanford, and they can access their care virtually. So we have patients log in from their office, from their home. We've even had patients driving and telling us that they're going to pull over to run the visit, which we encourage them not to do. This is really, again, improved accessibility of care, convenience for patients, and we've really limited the number of in-person visits required for our patients. So they only really need to come in once to meet the cardiologist, and then a couple times to do some labs at entry and labs when they graduate, before they graduate from the program. We run a multidisciplinary team approach to these patients' healthcare, and so as part of our program we have a lifestyle interventionist who does some NEST counseling with them. NEST is an acronym for the lifestyle intervention program that we've developed. So not only do we look at their dietary habits, but we also work on improving their exercise, spending less time sedentary during their day-to-day life, improving sleep, not only sleep quantity, but making sure they have quality sleep. We know that chronic sleep deprivation leads to chronic disease development. And then, of course, Transcend, the T, is focusing on patient overall emotional well-being and taking time to make sure that they are fulfilled in all aspects of their life. And just because I'm out of time, I'll just mention that we're very early in the launch of the CardioClick program, but our early results are very encouraging, very promising. So we found that patient engagement is very high compared to our traditional program, and we're starting to see that people are we're making some improvements with sort of heart outcomes. So we're seeing, 8-pound weight loss on average in 6 months, and we're seeing their lipids improve as well. And with that, I will stop.
Randy Stafford is next. I just want to say one word. You didn't have high blood pressure before, and then the guidelines changed, and now you have high blood pressure. Blame Randy.
Working to have an impact. So I could have talked with you about lots of different things, including taking off from where Ann Xing began in terms of the Wellness Living Laboratory in China. Also, I could have talked about some of my collaborations at Peking University around things like obesity, eye health, and even schoolyard bullying. But what I really want to talk about is the thing I'm most passionate about, which is this summer seminar at Peking University that has brought together both Stanford graduate medical students with Peking University students. So just want to say a few things about this. This is a 3-week seminar that's been funded by the Stanford Center at Peking University. And the themes over time have been looking at healthcare and public health, cancer and heart disease prevention, and most recently looking at health issues in adolescents and young adults. This is very much a bi-directional learning experience where the American students are learning about China, the Chinese students are learning about America, and in some sense it builds on this idea that globally, we're all converging towards problems like the US has, and China is probably doing that faster than most other countries. We take 6 to 8 Stanford medical or graduate students, put them together with 6 to 8 Peking University graduate students, many of whom have already gone through medical training. And we provide English instruction with both Stanford faculty as well as faculty from PKU. Here's just one session at the Stanford Center, which, by the way, is a beautiful building. If you're ever in Beijing, I would highly recommend visiting just for the experience of appreciating the architecture of this building. In terms of other details, we include multiple components that really kind of focus on how we can be most effective with teaching. And this includes the seminar portion, student group projects, trips to hospitals, clinics, and research venues, opportunity for academic and career advising, and then culminating in a public symposium at the Stanford Center. And these group projects are really the center of this. They involve groups made up of 2 Stanford and 2 PKU students, 1 PKU professor as an advisor, and the goal is for this group to propose a design for an intervention and a plan for rigorously testing that. There's a final project report, and then much to the anxiety of the students, they actually present their proposal at this public symposium. And here's the group from 2016, and I can attest that these students are very enthusiastic about the whole project. And this is something I'm looking forward to doing in the future.
Next up is Dr. Groves. And I have to say one thing, I never knew so many Stanford people were researching alcohol flush. We started the center, and so many people, so great, thank you, welcome.
Thank you. So I just want to see a show of hands since we've been standing up. How many people know at least one person that flushes after they drink alcohol? And then if you know more than one person, raise both your hands. Okay. And so why do we know that, right? Well, it's because the ALDH2 STAR2 variant, which causes this increase in flushing after you drink alcohol, it decreases aldehyde metabolism by 40 to 60%. This is actually highly prevalent in East Asian populations. Its origin is from the Han Chinese. And particularly in Taiwan, it's about 47% of the population that has this ALDH2 STAR2 variant. It's estimated that we have about 1 million people in California that have the ALDH2 STAR variant, and so I think it's very important for us to think about this when we start thinking about health and precision health and precision medicine, particularly because we're talking about the San Francisco Bay Area and not like the Green Bay Area, where there's actually a lot of alcohol, but very little people who flush when they drink alcohol. I actually got married there, so I know. So as you noticed when you walked in, Cho Hong Chen in the back there was actually handing out some, yes, was handing out a DYI alcohol intolerance test. And so basically, this is just a simple way to see whether or not you potentially have this genetic variant. There's a couple caveats here. This is for education and demonstration use only. The sensitivity of the test is only about 80%. And amazingly enough now, if you are really curious about having this gene, you can go on Amazon and purchase a small alcohol kit that tests 5 different genes for about, I think it's under 40 bucks. So you can keep those things in mind. So what do we do in my lab? In particular, we're interested in 2 different things. One thing is that how aldehydes, basically an aldehyde exposure affects human health. And so aldehydes are in a lot of different things. And some things are called lifestyle choices, such as alcohol and cigarettes. And so with a mouse that was developed in the Mauchly-Rosen lab, which is a knock-in mice for an ALDH2 STAR2 variant, we're looking at the effects of e-cigarettes on these rodents versus wild-type rodents. And we also are recruiting for an alcohol challenge in humans, so we can actually measure in the breath in real time the amount of acetaldehyde that's actually produced after you consume a standard unit of alcohol. ultimately, my goal is to start looking at how we can actually identify and treat non-modifiable aldehyde exposures. And so I'm, in particular, an anesthesiologist, and we know that aldehydes are actually produced quite significantly during surgery. And so if we can actually do this with, if we can actually identify aldehydes being produced, use real-time monitoring, and then intervene with treatment strategies, this could actually help with patient recovery, since aldehydes have been linked to reperfusion injury, pain, and cognitive dysfunction. My last pitch is that this is actually a collaborative effort, like it was mentioned in the introduction of the talk. And we've actually had a conference talking about ALDH2 and alcohol flushing and such that started in 2015, which was organized by Chi-Hong Chen and Daria Mochi-Rosen. And so another plug for Ansing's meeting is that we're actually also having about a full day of alcohol and alcohol intolerance talks during that time. So
Then
thank
you'll
you.
have a meeting later.
Yeah. So thank you.
Thank you, Eric. Before Dr. So comes up, I want to say a few words. I mean, really, you know, as I mentioned earlier, standing on the shoulders of giants, we really wouldn't be here if it were not for Dr. So. Dr. So, 20 years ago, is it?
22 years.
22 years ago started the Asian Liver Center, which really has, you know, revolutionized the education, research community around Asian liver research, in particular hepatitis B. So really, I would, you know, if you could join me in a round of applause for Dr. Singh.
No. So I think it was about a year ago when Lefa and Brian invited me to lunch and talk about this idea of this center, and I said, go for it. But the major challenge is finding donors to support you, right? So I'm very, I'd like to congratulate you for really putting this together and getting the support of the dean to really embrace this program. So I thought, you know, being the founder of the Asian Liver Center 22 years ago, so I thought what I'd like to do is share with you how that came about. Before I came to California as a transplant surgeon, I lived in the Midwest where there were very few Asians. At that time, Minneapolis and then St. Louis. But you know, after I came to the Bay Area, I always said is in search of better Chinese food. I found that many Asians dying from liver disease and liver cancer were caused by chronic hepatitis B infection, whereas most non-Asians were dying from liver disease due to alcohol-related liver disease or hepatitis C-related liver disease. And this is what I was like in the operating room. And what I found was many Asians were dying really because of lack of awareness. They were not aware of the seriousness of chronic hepatitis B. They were always told, oh, you are just a healthy hepatitis B carrier. But they were actually not told that they do run a 25% risk of dying from liver cancer or liver disease if they were not being monitored or treated. Many of them were not tested. Many who had chronic hepatitis B were not told